Hi, I'm Dr. Rodríguez-Feliz. I'm a board-certified plastic surgeon in Miami, Florida, and today I have an amazing patient that has allowed me to showcase what I do during a consultation for eyelid surgery. So these are some of the key elements that I evaluate in a consultation, and I usually start evaluating the upper third of the face and the mid-face, as they both relate to what's happening in the actual eyes actually. So when I look at the forehead, one of the first things, even without touching the patient, I like to see if they have forehead lines. When they have forehead lines, I know they're using the forehead to compensate, to keep their eyes open. So that could just be related to maybe some heavy brows. It could be related to some excess upper eyelid skin, but the one thing that I'm really looking for is to make sure they have eyelid ptosis or not. And eyelid ptosis means a droopy eyelid, and it's completely different from having a excess upper eyelid skin. So when I look at the forehead and I see either a brow that is peaking or forehead lines, that guides me directly to make sure that that patient does not have or does have eyelid ptosis, and that's a very critical part of the evaluation. So that's just even before doing any exam on the forehead. Then I like to see the position of the brows, and in her case I can see that there's a lot of laxity on the temple region. This is very important to address because this will elevate the corner of the brow, but it also limit the incision on the upper lid. And what I'm also noticing is she has a lot of excess skin that is more evident on the right side than on her left side, and a lot deeper space here, which goes on with what I mentioned before, that she might have a small amount of ptosis on that left eye. And it's very important to address that and identify that pre-op, because if it's not corrected in surgery, it can get worse. After addressing the position of the brow, the excess upper eyelid skin, and the position of the actual lid, then we go on to address or evaluate the lower lids. So on her, you can see that there is no showing on the sclera underneath, that she has a good positive tilt on her shape of her eyes, and that she has a good malar support. And all of those are very favorable to do a lower blepharoplasty. In her case, she has very significant lower lid bags and some excess lower lid skin, so all of those will be addressed with a lower blepharoplasty. So in summary, we are going to be performing on her temple brow stabilization. I'm going to be doing an upper blepharoplasty to remove the excess upper eyelid skin. I'm going to be fixing the ptosis, the droopy eyelid, and I'm actually going to be performing a lower blepharoplasty to help with their lower lid bags and excess skin.